Right, so if you have read and understood considering a clinical examination, kindly begin.
Thank you, Ma. I would first of all want to wash my hands and
Yes.
introduce myself to the patient and also confirm his age and date of birth. Once I've done that, this patient is in severe pain. I would
Yes.
want to want to give him something for the pain before I can start any form of examination. So I would
Okay.
ask him and then take permission to get that. Once he agrees to that, I'll get him something to help him with the pain. And once I've done that, then I would want to proceed with I will explain what I want to do to him. Firstly, I would want the examination entails to watch him walk, to look at his ankle, both
Yes.
ankle, especially
What
right.
will be the patient's position and how much exposure would you ask for?
Yes, I would want to expose his just from his knee. I will expose the knee joint and also the ankle joint.
Yes, good.
Just welding. So first of all, I would once I've obtained a verbal consent from him,
Yes.
then I would ask him to stand. Then I'll ask him to walk for a few distance to watch. I'll watch his gait.
Just suppose patient refused to get up and walk. How would you convince the patient?
Yes, I would tell him. I would support him while he's walking, and I'll walk by his side, and also I would observe his gait. For this particular patient, he might have an antalgic gait because of the sprained right ankle. So once I've observed the gait, I also want to inspect. I'll look at if there's any form of swelling. He has the swollenness of the right ankle. Then I'll look at the skin for any form of scar. I'll also look at if there's any form of muscle wasting, if there's any form of deformity in both ankles, especially the right ankle. Once I've done this, then I'll ask him to sit down. The next series of examination will be done while he's sitting. Then I would want to feel. I'll check bilaterally the temperature, starting from the tibia downwards. Then I would also want to check if there's any form of tenderness. I'll ask him if he's having any pain at that point in time before I elicit any form of tenderness, and I'll tell him I'll be gentle. Once I've done that, then I would also want to squeeze the metatarsals while I watch him if there's any form of grimace showing if he's having any form of pain. So I would squeeze both metatarsals, and once I've done that, then I would also assess the pulses. I'll check the popliteal pulse bilaterally. I'll check the posterior tibial pulse and also the dorsalis pedis, which I expect to be bilaterally synchronous. Then once I've done that, then I would explain to him certain movements. I'll tell him first of all, I want to assess the movements of the ankle joint. I'll tell him for dorsiflexion, I'll tell him to raise his toes towards the ceiling. That's active movement. For plantar flexion, I'll tell him to move his foot as if he's pressing on a pedal. Then I'll also tell him to move his foot inwards for inversion. For inversion, they also tell him to move his foot outwards for eversion. Once I've done that, then I want to assess the range of movements. I will then do passive movements by myself. I will now conduct all these movements while looking at him and ensuring he's not in any form of pain or discomfort. Then I'll carry out these movements again and note if there's any form of pain and also difficulty or stiffness of the joint. I would start all this examination with the normal foot, the left foot, and I'll end it with the right foot. Then I would want to conduct an anterior drawer test to assess if there's any form of anterior talofibular ligament injury. I'll start with the uninjured foot. I'll stabilize the tibia, then I would cup the heel of the foot, then I would move it anteriorly if there's any form of displacement. That means there's an anterior talofibular ligament injury. Then I would also want to do a talar tilt test. The talar tilt is a form of varus and valgus test. So the varus, for the varus, if there's any form of opening of the particular laterally or medially during dorsiflexion or plantar flexion, I can detect if there is an anterior talofibular or a posterior talofibular, or while it's in a neutral position, if there's a calcaneofibular ligament injury. Then for the valgus, if there's any form of that's medially, it will also confirm an anterior talofibular ligament injury. Once I've done this, I would then thank the patient. I would offer him assistance to dress him up if he doesn't mind, and I'll wash my hands.
There's another test, Siemens test. Are you not going to?
Okay, yes. Then I would want to. There's a Siemens test. I'll ask him to kneel down on a chair, and I'll squeeze his calf. A positive.
Yes.
If there's any form of calcaneal tendon injury, he won't be able to plantar flex. So
yes. Now you can thank them.
then I will thank the patient, and I will offer assistance to dress and then wash my hands.
Yes, to complete, can you present your case now?
To complete my diagnosis, I also want to do a full neurovascular examination and also do an examination of the knee joint.
Can you present your history examination now?
Yes, I've presented a 19-year-old basketball player. I examined a 19-year-old basketball player that has a swollen, he has an antalgic gait with pain in the right foot. He has a swollenness of the right foot, and also there's a difficulty in carrying out basic movements of the right foot. He's having difficulty in dorsiflexion and also plantar flexion. However, I couldn't carry out passive movements well because of pain on the right foot. However, his left foot was okay.
Yes.
So
what are your differential diagnosis for this patient?
Okay, I think he has a right calcaneofibular ligament injury.
Okay. Anything else that you consider? Fracture of lateral malleolus or base of the fifth metatarsal, cubate or cuneiform.
Yes, it could also have a fracture.
Combination injuries.
Yes, ma'am.
So please, can you tell me what investigations would you ask for to confirm your diagnosis?
Yes, I would request for an X-ray of the right ankle, an anterior posterior, and a mortise view, and also I would want to do an MRI.
Yes. So what are the treatment options that you can offer to this patient?
Yeah, the treatment option, if it's a mild ankle sprain, you would benefit from non-operative management. It would raise the leg up to reduce the swelling. Would be on analgesics, ice. I would give him ice packs to apply on the leg, and also and also to ensure he doesn't bear any weight for now on the ipsilateral.
If it is moderate to severe, then
moderate, you will need a back slab alongside all these other along my other management for the mild. So you will also need a back slab.
Okay. Can you please tell me if you've done the X-ray and X-ray comes out and you find out that there is undisplaced fracture of fibula with the swelling of the ankle, then how would your management differ?
Undisplaced fracture. Yeah, I would just back slab and non-weight bearing.
And the rest, ice and elevation.
Yes, and also
to reduce edema. Yes.
To reduce edema.
Very good. Good.
Analgesics for pain too. Yes.
That was very